Hi folks, it's Marvin Music with MedicareSchool.com, and we want to welcome you to this edition of Medicare Monday, where every Monday, 6 o'clock Eastern, 5 o'clock Central, we look into the subject of Medicare as well as Social Security, and try to give you the really the nuts and bolts of Medicare and Social Security to make sure that as you approach Medicare eligibility, or at least approach these decisions and begin to consider them, that you are making the right decisions, and you have confidence in those decisions. I have said this often, but I do want to kind of preface tonight's session with this. Do you have to be a Medicare expert, a Social Security expert, to make good decisions about those? And the answer to that certainly is you don't have to be an expert. In fact, I've been in this business 15 years now, and I still continue to learn some things. And so you're not going to be an expert before you're going to be put into a position where you make decisions. But do you have to know some things in order to make good decisions about Medicare and Social Security? And of course, the answer to that is absolutely yes, you do. And sometimes people just don't know what they need to know, and they're just really not familiar enough with either one of these systems to even ask the right questions. All right, and so that's really our topic during these discussions for Medicare Monday. And the reason for that, folks, is because the whole goal of our company is to make sure that we are the nation's most trusted resource for Medicare, Social Security education, as well as enrollment assistance. And so that's our goal, and that's what we do every single day for people throughout the country. All right, so let's get started. We titled tonight's session this, Do These Three Things as Soon as You Turn 65. So do these three things as soon as you turn 65. Now, I probably should title that, Do These Three Things as You're Approaching 65. You know, do them on your 65th birthday, but I do think these are things that you need to be paying attention to and really evaluating as you are approaching 65. So I want to get into the details of those next. So number one is this, and this is kind of a long statement, but it's this. Don't panic. And don't give in to pressure by people in the business. Okay, don't panic at all. Don't give in to pressure, but rather get a proper education. So that really is the key to making good decisions. Just kind of, take a couple steps back, breathe a little bit, relax, and start getting an education as you approach 65. There's a lot of people who panic. In fact, I had a call from a gentleman today out of Florida. His birthday is in February, coming up in here in about a month or so, and he was panicked. And there was no reason to be panicked whatsoever. He was still working, still covered by a group plan, large group, had good insurance, and yet he was panicking because he got some information from someone that really didn't know what they were talking about, and he was kind of getting emotional about that and responding as though I have to do something. And then he also made a statement during that conversation. He said, well, I have this period of time where I better do something. And he was totally wrong. In fact, had he made a decision during that period of time, he would have made the wrong decision. And so I was glad he reached out to me. I was able to kind of calm him down and make sure he knows, listen, you're in a good position right now, so don't panic. And so I'm just saying that to all of you. There's no reason to panic whatsoever. But it is time to get a proper education, and specifically about these two systems of Medicare and Social Security. You need to understand them. And again, you're not going to know everything about them, but you need to know some essentials. And so I'm going to stop right there with this first point and talk about getting an education about how Medicare and Social Security work and some of the differences. Because they're certainly two different systems. Social Security is all about your income, and Medicare is all about your health insurance. And so let's start talking first off about what you need education for in regards to Social Security. Number one thing you have to do is you have to make sure that you know your full retirement age. Now, some of you watching this probably do. Just a quick overview about that. You have to know your full retirement age because that's going to impact how much you're going to make. And also, if you're going to keep working, how much money you can make if you're going to take Social Security and work. And so that's why full retirement age matters. And it's very simple formula. Number one, anyone born between 1943 and 1954. Got it? Birthdays in 43 all the way up to 1954, you have a full retirement age of 66. Beyond that, starting in 1955, Social Security began to add 2 months to our full retirement age. So if you're born in 55, it'd be 66 and 2 months. 1956, 66 and 4 months. 1957, you had 6 months, sorry. 1958, you had 8 months. 1959, you had 10 months. And then in 1960 thereafter, it's very simple. You have a full retirement age of 67. Now, so you got to establish that full retirement age. And so the way to do it is you know your birth year, you add 66 to that. And so if we have to add months to that, if I was born in January and I have to add 6 months to it, I'm going to count those 6 months: February, March, April, May, June, July. So in July, I would hit my full retirement age. If you're born in 1959, you're going to add 10 months to that. And so again, if you're born in January, you'll be 66, and then add 10 months: February, March, April, May, June, July, August, September, October, November. You hit your full retirement age. All right, so you have to know that. Now here's why that matters. Because we can take Social Security prior to our full retirement age, for sure. In fact, we can take as early as 62. But when we do so, we take less. And basically, it's in the range of about 6 to 7% a year less. So if you take at 62, you're going to lose about 25% of your full retirement age benefit amount. Now, you have the money, but you're going to take less, and that's going to be a permanent reduction other than when the government takes their cost of living adjustments due to inflation. And so we take early, we're going to take less, or what we can do is go to full retirement age, and then we don't have to take less. We'll get that full benefit that they will list on the Social Security website. And then if you don't want to take then, you can delay taking Social Security, and some do that. And so as we delay, we don't take it for retirement age, we're going to grow that account. It grows at 8% a year. So you can wait till age 70 and you're going to have 32% more money, and that's a permanent increase. Now, the issue is you're going to have to live long enough to know that that was a good decision. There's always a break-even point, usually in the early 80s, maybe mid-80s. And if you live beyond that, you will know that was a good decision to delay. So if you don't have to have the money and you want to grow that account, for some people, that's a wonderful decision, especially those who are married and their spouse is younger, and maybe that spouse doesn't have as much Social Security benefit because they'll get survivor benefit. They'll get that widow or widower benefit, and it could be a greater amount than their own. So the whole point is you've got to decide full retirement age. So you can take early, you can take later. Take less if I take early, take more if I delay. Those are called delayed retirement credits. Now, the second issue that's important for you to be considering is if you do decide to go ahead and take early before you hit full retirement age, you can certainly continue to work, but you're going to be limited as to your income. And here's the way it works. Very simple formula. I can take as early as 62. So from 62 until before the year you turn full retirement age. All right. So what that means is from 62 to December of I'm still 65, that period of time, right now, if you're making that decision, the most you can make in wages, meaning you're working, is $21,240. If you're taking notes, that's called an earnings test. So from 62 up until that December, while I'm still 65, meaning I haven't turned 66 yet, but in December, I can make this year $21,240 in wages, meaning I'm working. Okay, that's called the earnings test. Now, what is not tested for earnings test would be any kind of a pension, any kind of retirement income that you're getting, any kind of distributions you're taking from your IRAs or your 401ks. There's no rental income in there. In other words, investment income, retirement income, none of that's counted, only working wages. So from 62 to December, before I turn 65, I can make $21,240 in wages. For every $2 I make above that, they take $1 out of my Social Security check, right? And so if you're going to be above that, there will be some consequences to your Social Security. If I stay below that amount, no consequence whatsoever. Now here's where it gets confusing. If you're still working and then the year you turn full retirement age, this is a year you turn. Now, you're not yet full retirement age month, but you are turning that year. And so let's say I'm going to turn full retirement age, let's call it November of 2023. That means this year, from January all the way up until October, again, I'm not yet full retirement age month, but I'm in that year I'm turning, you can make substantially more money. Earnings test goes way up. And that is this year, $56,520 a year. $56,520. For every $3 above that limit I make, they take $1 out of my check. So I can make almost 3 times the amount I could when I was younger, and my penalty is also less. Okay, so my whole point is if you decide to take before full retirement age, you're going to be limited on your wages. But once you hit full retirement age that month, then that earnings test goes away. You can make as much money as you want, and you can draw your Social Security at the same time. There's no consequence whatsoever. Okay, so now let me just share this with you as far as getting an education about Social Security. First thing we'd establish for retirement age. Now, the second thing you need to know is that there's a couple ways in which we can take Social Security benefits. The most common way, in fact, this is 50 million people out of 70 million people take it because they're taking retirement benefits, meaning they're drawing benefits off of their own work record. And that's because they paid into the Social Security tax system for at least 40 quarters. Most people paid a lot longer than that, but it's based upon your highest 35 years of earnings. And they average all that out. And of course, they index it towards, forward because of inflation. But once they've calculated those highest 35 years of earnings, that total amount, they divide that by 420 months. And they take that number and they apply it to what's called bin points. And so it's a little bit of a complicated formula, but that's what determines your full retirement age amount if you're going to take your own retirement benefit. All right, so it's based upon that amount of income years divided by 420. Okay, here's my point. Not everyone takes just their own retirement benefits. You're also eligible for, some people are eligible for spousal benefits. Spousal means that I'm taking benefits off of someone else's work record, meaning I don't have much of my own or I have none of my own, and you can actually draw spousal benefits. Now keep in mind, the same thing applies. You can take as early as 62 spousal benefits, but again, there's going to be a reduction in benefit. And so basically what happens, spousal benefit at its highest is 50% of whatever that spouse that you're drawing from would be eligible for at that spouse's full retirement age. So if that spouse is eligible for $2,000, 50% of that would be $1,000. But if you take early, that $1,000 will be reduced. If you wait to your own full retirement age, then you would get that $1,000 for spousal. That means someone is alive. You're drawing off their benefit. And that benefit could be someone you're married to now, as long as you're married for 1 year, or someone you were married to previously. As long as your marriage lasted for at least 10 years and you did not remarry prior to the age of 60, and that person is eligible for Social Security, then you would be eligible for spousal benefits, even off the ex-spouse. And so there's a few rules about that, but in general, that's the way it works. And then also we have survivor benefits. This means someone has died, and this could be widower benefit or a widow benefit, and we can begin to draw those benefits as early as 60. But when you take early, again, you take less. And so the survivor benefit would be yours as long as you were married to someone and they died. And if you were married to them 9 months while you were married, you're eligible for survivor benefits. If you are divorced from someone and they died, again, you could still draw benefits off of them as long as your marriage lasted for 10 years or longer and you did not remarry prior to the age of 60. Again, you can draw from that ex-spouse that has deceased. And so my whole point to you is you've got to get an education about how Social Security works, because you can take Social Security without being on Medicare. Now, do keep in mind, if you are on Social Security, you have to be enrolled in Medicare Part A. It's a requirement. But you don't have to take Part B if you or your spouse are still working and you have a good group plan. So I can take Social Security without taking Medicare B. I can also then take Medicare without taking Social Security, and that's what I'm trying to teach you tonight. You've got to get educated about these two different systems. So we have a little bit more understanding about Social Security. Now let's talk about the general aspects of Medicare. Of course, Medicare is all about health insurance. The majority of people that qualify for Medicare are doing so because they have accumulated 40 quarters into the Medicare tax system. 10 years worth of work. Most of you have had a lot more than that, but you have to have at least 10 years. If you don't have your own 10 years, again, you can draw from a spouse or even an ex-spouse, even a deceased spouse, depending upon how long your marriage lasted and what the situation was. So we can get spousal benefits through Medicare just like we could off of Social Security. And so when it comes to Medicare, it's health insurance for those that are approaching 65. Now, you're eligible at 65, but it doesn't mean you have to take it 65. Okay, I'll talk about that in just a minute. But Medicare is this health insurance system for those that are 65. Now, the exception would be there are people that can start Medicare earlier than 65, based upon a couple factors. Number one, if a person has Lou Gehrig's disease, they can start Medicare when they're diagnosed with Lou Gehrig's. If they have end-stage renal disease, permanent kidney failure, again, they can start at any age as well. And so other people that can start Medicare prior to 65 are those that have been diagnosed with a disability, emotional disability, physical disability. And what happens is they're receiving Social Security disability benefits for 24 months. On the 25th month, they're automatically qualified to be in Medicare A and B. And this is why you meet people that are on Medicare that are 61 or maybe 52 or 47. My youngest I've ever put in was 37, already on Medicare. Why? Because on the 25th month, they're automatically eligible for Medicare A and B because they're on disability. Okay, and so Medicare is all about health insurance. Now, when we talk about Medicare, you have to realize that when a person goes on Medicare, if they decide to stay in what we refer to as original Medicare, that's the A and B of Medicare. And that means that they've enrolled in Medicare A and B. A of Medicare is the inpatient side. That's the hospital and skilled nursing side of Medicare. And the B of Medicare is pretty much everything outpatient related as well as all doctor services. So all the doctors that treat Medicare patients are paid through Medicare B. Those are the doctors that you see in their office or they come to see you in the hospital. And that's what I want you to remember as you get an education about Medicare. B is outpatient and doctor services as well as durable medical equipment, diabetic supplies and oxygen equipment and CPAP machines and scooters and wheelchairs and walkers. That's all paid through the B of Medicare. And that's why they have two systems in Medicare. A is inpatient, B is outpatient, as well as all doctor services. And so when you enroll in A and B, then what that does is that makes you eligible to get other insurance beyond A and B. It is very few people that have A and B only. It's just too risky to do that. And so once I'm enrolled in A and B, then I have two different options for getting additional insurance. And there's only two, and you have to decide which one of those two you want to use. And those two, we call them systems, are really totally different. The only thing they have in common is that we have to be enrolled in A and B. Now, let's go back for just a second about A and B. A for most people has zero premium. Doesn't cost you anything on a monthly basis. Now, your services under A are going to cost you something, co-pays and such. But as far as getting the Medicare Part A, Medicare doesn't charge you anything for Part A premium. It's zero as long as you or your spouse have 40 quarters and you're eligible for premium-free A. And that's premium-free A for life. There's no cost. But if I don't have 40 quarters, then I try to get those from a spouse or an ex-spouse. If you can't do that, then you can always either go back to work and try to get to 40 quarters, or you actually can buy Medicare A. But again, 99% of all people get A at zero premium. All right, now B is different. B is the outpatient side. Remember the doctor side. B has a premium this year. And by the way, today is January 16th, 2023. And so the premium for this year is $164.90 a month. For your Part B premium. That's $164.90. If you're on Social Security, that comes out of your Social Security check. If you're not, they'll bill you quarterly, or you can actually set up a Medicare, they call it Medicare Easy Pay, and it's actually a bank draft. They'll do monthly until you start taking Social Security. All right, so you got to pay for your Part B. Now, here's where it gets kind of interesting in that not everyone pays the same amount for Part B. So the Part B premiums are based upon your income, specifically called your modified adjusted gross income. MAGI is the acronym they use. And so if someone's on Medicare in 2023, their Part B premium is based upon their 2021 modified adjusted gross income. So Medicare always looks back 2 years. Well, why don't they look back one? Well, I don't know about you. I haven't filed my taxes yet. I have all the way to April 15th to do it anyways. And so they don't look back one, they look back 2 years. So if I'm on Medicare in 2023, I'm looking at my modified adjusted gross income in 2021. And the modified adjusted gross income is a very simple formula. It is your adjusted gross income that's on your tax return, and they modify it by adding back in any tax-exempt or tax-free interest income. Municipal bonds, sometimes savings bonds, income that's earned through a foreign company, sometimes is not subject to federal taxes. And so anything that's not subject to federal taxes, that number is added back into your adjusted gross income, and that sum of those numbers become the number Medicare looks at to determine your Part B premium. Okay, and so what we have is we have different levels of Part B premiums. Now, 93% of all people right now pay what is called the standard premium. That's the $164.90 a month that I talked about. That's what 93% of all people pay. And so the reason for that is because they're below the threshold that Medicare establishes, and those change every year, but they're below the threshold, the income threshold. And so those thresholds are these. If you're a single filer, if you're at 97,000 modified adjusted gross income, remember 2021, or below, then you will pay the $164.90 a month for Part B. If you're above that, then you're going to pay more. I'm not going to get into that tonight. But those additional amounts are surcharges called IRMAs, income-related monthly adjusted amount. So they add to your Part B premium. Okay, if you're above as a single person, above 97,000. And those additional surcharges, depending on your income level, they have 5 different levels of IRMAs. The lowest is right about $70 a month. The highest is about $475 a month. Okay, and so the 93% of you pay that. So if you're above the 97,000, you'll pay more. Now, if you're a married couple who file a joint return, not married filing separate, that's a whole different category. Married filing a joint return, which is most of you that are married, the income threshold is $194,000. So if I'm below $194,000, modified adjusted gross, each of you would pay $164.90 for your Part B. If you're going to be above that amount, then again, you're going to have those surcharges, those IRMAs that will be added to your Part B premium. All right. And in addition to that, if you are high income, above 97,000 single, above 194 as a married couple, then you would also pay additional IRMAs for your Part D plans, your prescription drug plans. They'll add a small amount to that as well. Not a whole lot, but anywhere between about $12 to about $50 a month. All right, and so that tells you the basics of Medicare A and B. And so remember what I said, we have 2 ways in which we can get additional insurance. One of those is to get a supplemental plan to fill in the gaps that Medicare doesn't cover. So Medicare pays, but you'll always have a balance of the bill. Okay, other than preventive, nothing in Medicare is 100%. Any service you get, you're going to have some responsibility, some financial balance of the bill. We call those gaps in your coverage. Okay, and so people that stay in original Medicare A and B are going to have some balances, some gaps financially that they're going to be responsible for. If they don't want to take on that financial liability, they can buy a supplemental plan, also called a Medigap policy, to cover those gaps. All right. Now, anyone that's born before January 1st, 1955, meaning eligible for Medicare before January 1, 2020, can get a full coverage plan called the F plan. All right, and there's millions of people that have those, and as long as you're born before January 1st, 55, you can get an F plan, full coverage plan. Those of you that are watching this are born after January 1st, 55. There's 2 plans that are most popular today. The most popular would be called the G plan, and the G plan will cover 5 of the 6 Medicare gaps. Remember what I said? There are 6 gaps in original Medicare, 3 on the A side, 3 on the B side. And so people that get an F plan, all the gaps are covered, full coverage. But again, you had to be born before January 1st, 55. So those afterwards, most people are getting what's called the G plan. It covers 5 of the 6 gaps. Not quite full coverage. You would be responsible for 1 gap if you have a G plan, and that's the Medicare B deductible. Once a year, you would have to meet that deductible. This year, it is $226, which simply means if you're on a G plan, the very first $226 of bills that is going to be processed through the B of Medicare would end up as a bill in your mailbox. Could be a couple doctor visits with lab. Could be, $226 of cataract surgery, $226 of an MRI. But the first $226 once a year is your responsibility. After that, we have full coverage. Okay, and then the plan below that, not as popular as the G plan, but it's called the N plan, a different letter, a different supplemental plan, and it covers 4 of the 6 Medicare gaps. Okay, it doesn't cover the B deductible. Remember, the only one that did that's the F plan. The G plan doesn't cover the B deductible, nor does the N plan. But the N plan also will not cover what is called excess charges. And this is something that happens on the B of Medicare. And this is when a doctor adds 15% to the bill. Doctors are allowed to do it. Some do, some don't. But those that add to the bill, 15% excess charge. If you have an N plan, you have to pay that if and when that occurs. All right. 42 of the 50 states allow doctors to add excess, 8 states do not. Okay, but the whole point is if you have an excess charge, you're liable for it. And then lastly, on the day plan, you do have a lower premium, of course, than the G, but you also, every time you see a doctor, you have to have up to a $20 copay, go to the emergency room, a $50 copay. Now, all I'm trying to teach you is that when we look at the basics of Medicare, you have to make a decision as to what system that you want to use your insurance. Do you want to stay in original Medicare A and B, fill in the gaps with the supplemental plan? All right. And if you do that, then you also have to have a drug plan. We call those standalone drug plans. They're separate drug plans. And those are for the medications that we self-administer. Heart meds, your cholesterol, those kinds of things, insulin, those kinds of things you self-administer. We have a Part D plan that is separate. Okay. So that's one way to use your Medicare. Now, the other way to use your Medicare is totally different. Again, I'm enrolled in A and B, but now I do what's called the C plan. These are called Medicare Advantage plans. These are called the replacement plans. Now we have a private health insurance company that's basically replaced Medicare for us. And when we go in that system, what has happened is that private health insurance company, Medicare Advantage plan, will put together a network of doctors that are in the network, HMOs or PPOs. They'll set together a schedule of copays for the services that we get with a max out of pocket. So it's kind of a pay-as-you-go system. The Medicare supplemental plans, we don't pay as we go. We pay a premium and we're pretty well done. If we have an Advantage plan, we usually don't pay a premium, but we pay as we go. If we go to the hospital, $350 a day for 5 or 6 days. Have an MRI, maybe $250. Have a CAT scan, maybe $200. So the different services you get, you pay as you go. And so those two systems are available to you. And so I'm just teaching you that when you go on Medicare or Social Security, you want to get an education as to how these are going to work. Okay? And so what I would suggest on this point, number one, getting education is this. Our website, we have a YouTube channel. You can go there. There's lots and lots of videos, and we'll teach you about it. There's others out there that provide information about it. Okay? So get an education. But do me a favor. Don't get an education by asking everyone you know what they've done. Because I will tell you that is going to lead to a lot of confusion. Now, it doesn't hurt to get opinions, but the problem is sometimes people ask what their friends have done, and I always say this, well, do you take the same medications as your friends? Do you see the same doctors as your friends? Do you have the same health conditions as your friend? And the answer to that is no, you don't. You're different. You're a different person. And so don't copy what someone else has done. And usually the decision people made, they believe it was the best because it was best for them. Doesn't mean it's the best for you. And I've seen a lot of people make mistakes simply by copying what their neighbor did or their friend did or whatever. Now, if you do what your spouse did, then that's a little bit of a different issue. That may be good. But decide what plan's best for you based upon your health conditions and your medications and your doctors and even the risks that you're comfortable with. Make a decision based upon those educated facts. Okay, so number one, what I'm going to do is I'm approaching 65. I'm not going to panic. I'm not going to give in to pressure from other people. I am simply going to get an education from resources that I know understand the Medicare business. Let me just say this lastly here. Be careful about getting information from an HR department, okay, meaning people in human resource departments. Now, I am not saying that they're not intelligent people because they are, but a lot of times people in HR, most times, do not really understand Medicare fully. And I've seen a lot of people make mistakes from advice they got from people in the HR department that didn't know what they were talking about. And they followed that advice and it cost them dearly. Be careful about that. Okay, so a lot of people get bad advice and they act upon it, and it can be a very costly mistake. Okay, so that's number one. Don't panic. Don't give in to pressure. Get a proper education. Now, number two is this. Decide at 65 if you're going to start either Medicare or Social Security. You got to make that decision. Okay, and I've already told you enough about Social Security, I think, where you understand the implication of that. But here's what I want to make clear tonight about making this decision about Medicare at 65. Okay, some people must start Medicare at 65. Some people may want to start, and some of you shouldn't start at 65. All right, so let's talk, first of all, about those of you who must start Medicare at 65. And that would be you. If you or your spouse are no longer working and you have no employer plan option, no group plan available at work, you must go on Medicare at 65. Now, if you or your spouse are working and your company is small standards by Medicare means there's 19 employees at the company or less, then you also must go on Medicare at 65. right? So what am I saying? I'm saying that everyone must go on Medicare at 65 except one group of people, and that is if you or your spouse are still working and you have 20 employees or more in that plan, you're not required to go on Medicare. You don't have to take A, you don't have to take B whatsoever. Okay, now remember, if you're on Social Security, you got to take A, but we don't have to take B if we're covered by a group plan that has 20 employees or more. All right, and so I'm trying to teach you who must go on Medicare. Well, if you're covered right now by anything other than a group plan of 20 or more, which means you may have a retiree plan, you may be on COBRA insurance, you may be covered by an Affordable Care Act plan, or you may have no insurance. You have to go on Medicare at 65. This is your opportunity to do it, and you must do it during a 7-month window called your initial enrollment period. That is 3 months before you turn 65, the month you turn 65, and 3 months after. So if you have to start at 65, my friend, you have 7 months to do it. If you don't do it now, you'll be subject to penalties and problems down the road. So if we have to start at 65, we have 7 months, 3 months before, month of, 3 months after we turn 65. And the month that you decide to enroll into Medicare will determine when they start your benefits. So let's just keep it simple. Let's say that my birthday is July 15th, 1958, meaning I'm going to turn 65 this year in July. 3 months before, back up the clock, June, May, April. So I got April, May, June. I can enroll. My Medicare starts July 1. But if my birthday is July 15, 1958, and I enroll during the month of July, they'll delay my coverage until August. If I enroll in August, they'll delay me to September. I enroll in September, they'll delay me to October. So they're going to start putting you off as far as your effective date. And so if we have to start at 65, let's do it those 3 months in advance. That's called your initial enrollment period. So if you have to go on Medicare, it's because you or your spouse no longer working, you don't have a group plan available, or you're in a small group, 19 or less. All right, and so now that's for those of you who must. Now, may I emphasize one thing? Remember, if you're on an Affordable Care Act plan, technically you can keep those plans. But remember, all the benefits of the ACA plans go away. You will pay full premium. You'll pay a full deductible. There will be no cost sharing whatsoever, any tax benefits either. So that's why you get off of an ACA plan once you're Medicare eligible, and you, of course, go on Medicare. All right, and so that's for those of you who must. Now, for those of you who might want to go on Medicare, who would that be? Well, that's those of you that you or your spouse are still working, you're covered by a group plan that has 20 or more, but that insurance at work is not very attractive, meaning it's a high premium. Had a guy recently actually worked for a car dealership. It was a large employer, but his out-of-pocket expense for his premium for his insurance plan at work was $680 a month. Okay, we can go on Medicare half that price. So he was paying way too much to be on that group plan. It was large, didn't have to go on Medicare, but it made financial sense to do so. So always look at the group plan, see what the premium is, and sometimes it makes financial sense to go off the employer plan, keep working there, but you just go on Medicare. Sometimes your employer will give you a pay raise for doing that. Now, they can't incentivize you to do that. That would be illegal. But if you say, hey, I'm not going to be on the group plan anymore, they may say, hey, I'll give you a pay increase of $300 or $400 a month to help offset some of those expenses, because they're probably spending more than that anyways. All right, so the point is, those of you who might want to look at the group plan, compare it to Medicare. What's your premium? What's the deductible? All those kind of things go into that equation. And by the way, if you want some help comparing those two, we'd be happy to help do that for you, or any real experienced broker ought to be able to do that. But look at those plans. Okay, now keep this in mind. Never make that decision if you're married to someone that's also on the plan at work and they don't have other insurance options. Because why? You go on off the group plan, they're going to lose their insurance as well. Now, if they have a place to go to get their insurance or go to the healthcare exchange, then that's still fine. But you don't want to hurt anyone that's covered by the plan. Sometimes people have their children on the plan. Remember, they're covered up to age 26. And if they don't have a place to go to get their insurance, again, you're not going to make the decision to go on Medicare. So sometimes we stay on it even if it's not a real attractive plan, because our dependents don't have another option. Okay, so that's who might want to. Now let me tell you who should not go on Medicare even at 65. And that would be anyone who is covered by a group plan, you or your spouse are 20 or more, and that is an attractive plan. In other words, the premium is maybe $150, $200 a month per person or whatever. So it's very attractive. You like the plan. If it's 20 or more employees in your group plan, you do not have to go on to Medicare at all. Now, the danger is a lot of people hear that, yeah, they can stay on the group plan and keep working their spouses, but they're told they have to take Medicare A. And folks, that's absolutely not true. If you're covered by an employer plan 20 or more, you don't have to take A or B at all, and you will not be penalized for Medicare A. And again, this is a mistake that this fellow from Florida was about ready to make. He was going to go ahead and enroll into Medicare. And of course, I started asking all the questions to make sure he was doing this at the right time. And what happened, I said, are you contributing to an HSA? He said, oh yeah, we have an HSA at our work. I said, well, you realize that if you go ahead and keep working and you enroll in Medicare Part A, then you can put no new money in your HSA. His birthday's in February. So he would have to make his last contribution in January. He is done. That's it. Okay. By the way, it's prorated. He can't put the full amount in January. It's just that 1/12 of the amount that's allowable for this tax season. And so the whole point is, if you have an HSA at work and you want to keep contributing to that, you do not want to enroll in Medicare A because those contributions would really be ineligible. Now, if you're going to keep working and you don't have an HSA and you don't think that's ever going to happen, then it's all right to enroll in a Medicare A only. All right, you can do that. But remember, when you do that, no new money goes into an HSA. You can't enroll into an HSA in the future once you enroll in Medicare A. And also that in that position of if you have a health bill, you go to the hospital under Part A, Medicare pays second. Your group plan, because it's 20 or more, is still going to pay first. And when Medicare is in the second payer position on the A side, they will not pay any deductibles, they don't pay any copays, but they could pay coinsurance. So they may cover something that the group plan did not cover. Hopefully that would happen for you. So it's all right to enroll in A unless you have an HSA. So that's those who must enroll, right? Those who may want to enroll and those who should not enroll. If you got a good group plan, stay on that plan. And just think about it logically. Medicare's glad you're going to stay on the group plan. They're not liable for you. And that's why they make it so easy for you to come into Medicare at a later date. And that is called the special enrollment period. And all we have to do to bring someone in, and this is what I told this fella, he wants to work a couple more years. I said, keep working, keep contributing to your HSA. And then when you get ready to go into Medicare, well, all we have to do is verify that you've been working and you had a credible coverage insurance plan back to 65. And we verify that credible coverage with a form called an L564. You can find that online. You work with us, we'll do it for you. But it's an L564. And so all I have to do is prove that we've had credible coverage back to 65 with no months missing at all, folks. You got to have coverage all the way back to 65, and we can bring you into Medicare under special enrollment period, and we get to actually pick the date that we want to start the coverage. That form's called a 40B, a CMS 40B form, and we just pick the month we want to start. So my group plan ends June 30th. I got to verify I've had credible coverage back to 65, and I say, please begin my Medicare Part B July 1. So it's a very, very seamless, smooth transition. If you decide to be covered by a group plan of you or your spouses for 20 or more, you don't have to go on Medicare. Okay, so that's the systems, and that's the time in which you need to do this. All right, so enough of that. So some need to start now, some need to start later. I'm going to go to number 3, and then we'll close this out tonight. The last piece of advice I would say to you is this: find someone to help you that you can trust. Okay, find someone to help you that you can trust. And again, folks, there are people who know some things about Medicare, but sometimes they know just enough to be dangerous. And I'm just telling you, that's the way it's going to be with a lot of your neighbors, family members, HR people, coworkers. They've heard this, they've heard that, and some of it they kind of get it's repeated and it gets turned and twisted. Be careful. Find someone who really knows this business. And listen, I've been in it 15 years, and I think I'm pretty much a pro now. But I will tell you, the first couple of years that I was in this business, I was still really learning a lot. And so sometimes rookie agents, if they haven't written a couple thousand policies and been at this for probably 3 to 5 years, they're still a rookie. They haven't seen enough cases, seen enough scenarios to really give you good advice. So be careful who you use. And as I said so many times on this stream, our company is not the only honest people in this business. We're not. There's some great people in this business. But there's also a lot of people who are just chasing the biggest commission they can get and really not too concerned about your coverage or worried about commission. And I meet those kind of people all the time, and I hear from people who've had that experience. So find someone that really, really does care about you. And let me just tell you a couple ways you'll know. Number 1, you'll know if someone is experienced and cares about you if they start off a conversation something like this. Ms. Jones, Mr. Jones, are you already receiving Social Security benefits? Well, why does that matter? Well, because if you're receiving Social Security, you're automatically enrolled into Medicare. They're going to want to know that. You get your card 3 months before you turn 65. right? So I want to know that because I want to know if we are going to go on Medicare, are you already on Social Security, or are we going to have to set up a self-enrollment? If someone cares about you, they will walk you through the Medicare A and B. They'll make sure that your enrollment's done properly. We do it for our clients at no cost whatsoever. Why? Because it needs to be done right. If you're coming in later at 67 or 68, there's that additional paperwork, the L564, the CMS 40B. If someone cares about you, they'll walk you through that process. They'll understand that process. If they don't, then again, they're rookies. You want someone that really understands. So they'll ask questions. Tell me about your other insurance options. We have people all the time that are approaching 65 and they're going to go ahead and retire, but they're married to someone that's younger that has a very good group plan. Well, I want to know about that group plan. What's the premium? What's the deductible? Why? Because you can be covered by your spouse. You don't have to go on Medicare. And someone who understands the business and cares about you will want to know about that. Some agents want to jump right into a plan. No, let's find out about your situation first. And so, are you on Social Security or not? Do you have other group plan options? Are you still working? Let's find out about those plans where we jump right into Medicare. If someone cares about you, they'll ask. Number two, if someone who cares about you, they're going to want to make sure, do you understand the differences between supplemental plans and advantage plans? And frankly, hey, there are probably, I don't know, maybe 3 out of 4 agents today in this business that all they want to do is talk about advantage plans. Why? Well, because they pay us the most money. In other words, they're going to try to sell something that's going to give them the biggest commission. And so they don't care about your coverage. They care about their commission. And again, I'm telling you, if someone doesn't tell you about both of these systems, and I'm talking about the good, the bad, the fine print, the ins and outs of both these systems, then that's not a good, honest agent. If they're only going to talk about advantage plans, and basically what they do is just tell you about all the perks, kind of like the commercials on TV who tell you about all the perks, but don't tell you about how advantage plans work. Advantage plans are fine insurance, but there's some things about them that you need to know when you enroll into them that are they're consequential. Things can happen. Number one, networks. You need to make sure if you're on an advantage plan or your provider's going to be in the network. If you're on an HMO, you got to stay in your network. I literally just got this happened about 2 weeks ago, maybe 3 weeks ago, got an email from a guy whose dad was on an advantage plan. He was on an HMO, which means what? You can't go out of the network unless it's an emergency or urgent care. Okay, so his dad, had something seriously wrong with him, and there was a provider they wanted to see that was out of the network, and that HMO plan would not approve it. And I promise you, he wrote me an email and he said, my dad died, and he said, I blame that decision for not allowing him to go out of network on that advantage plan. I had a lady, I could get it, it's in my office, which is about a few steps away. A lady wrote me, and she said her husband was discharged from a skilled nursing facility prematurely, and she said that resulted in his death. Okay, he died at age 74, and he should have stayed in the skilled nursing facility longer. Why'd that happen? Well, because that Advantage plan had caseworkers work in the skilled nursing facility, get people out, and he got discharged early. And again, I'm not saying they died because of that, but I'm saying their family members said they attributed their death to that kind of a situation. So my point is, when agents only want to talk about Advantage plans, and they don't talk about the fact that you have network issues that you have to deal with, not every doctor takes them, not every hospital is going to take them. They're just not going to. You got to find that out. You also have to realize that with Advantage plans, there are pre-authorizations. And if an agent does not tell you about this in advance, you run as far as you can from that agent because they're not honest. A pre-authorization means this: if you're going to get certain services on the Advantage plan, before you get those services, it's going to have to be pre-approved by the insurance company. And that would be MRIs, CAT scans, skilled nursing stays, knee replacements, hip replacements, hospitalizations, non-emergency. That has to be pre-approved by the insurance company. So a doc could say, we need a knee replacement, need a hip replacement. That doesn't mean you're going to get that. No, because on the Advantage plan, that Advantage company has to pre-approve that before it's going to be paid for. And sometimes they do approve them, but sometimes they delay them. Sometimes they flat deny them. They say, no, we're not going to pay for that. We think that therapy is what you need first, or you have injections in your hip or in your knee or whatever, steroid stuff for a time, and then maybe we'll revisit this knee or hip replacement. That just happens. Now listen, I'm not trying to scare you. That's not my motive whatsoever. Hey, I make more money when you take an Advantage plan. But ethically, I owe it to you to make sure you understand what you're getting. And an honest agent will always tell you how the Advantage plan is going to work. Not just that it has dental and vision, hearing, and you can go to the gym for free. Okay, they'll say that, but that's not all to the story. There's more to the story than how is this going to work. You've got to know that. And an honest agent will talk about that. Networks, pre-authorizations. And then here's the real big one. Though I think pre-authorization is a big deal, but this one is the fact that if you go on an Advantage plan, and you stay on that Advantage plan more than 1 year, 2, 3, 4, 5 years, more than a year and a day, if you want to get off the Advantage and you want to get onto a supplemental plan in 46 of the 50 states, so what I'm saying does not apply in Massachusetts, New York, Connecticut, and Vermont. Doesn't apply there. Okay, so 4 states off. But all the 46, if you want to get off of your Advantage plan and you want to go onto a supplemental plan and you've been on the Advantage plan 1 year and a day or more, now you got to medically qualify to do that. So now to make this move, you have to medically qualify. I have seen agents who have put people that had COPD or spinal stenosis, or had one not long ago. The guy was, he had psoriatic arthritis, okay? And all those people were on Advantage plan. They were on it for a few years and they wanted to move. But of course, those health conditions are all deniable. They couldn't get approved to get a supplemental plan. And they had no idea whatsoever because that agent that wrote that plan did not tell them that. Now, the agent got a good fat commission for life, but they did not take care of that client. And all I'm trying to teach you is that when you approach 65 and you go on Medicare, Social Security, you got to get someone that you can trust. Will they find out about your health issues and your conditions, your concerns, your risk level? Will they evaluate all that to make sure when they give you that advice, you are going with the right plan? It may be an Advantage, but it may be a supplemental plan. And so an agent that's honest will tell you about both of them, the good, the bad, the fine print, the ins and outs of both of those systems. And then lastly, an agent who's worth working with is going to be someone that also has a customer service team. Okay, and if they say to you, well, I'll take care of all my customer service issues, well, I guarantee they don't have very many clients, okay? Because a person can only do so much. And so that's why we at our company and others like us have a customer service department. We're going to set the plan up. We're going to do everything right, give you the right advice. But you may call in, I'm on another appointment. You need service right now. Well, that's why you go to our customer service team. And you'll go there and we'll help with whatever problem you're having. We'll take care of that. And so when someone shows up and they work out of the trunk of their car, they don't have a customer service team. And by the way, I'm not knocking those that go to people's homes. We don't do that at all. I'm not going to do that. But the point is, sometimes those are just kind of a one-man show. And they write plans, but they can't service plans because there's not enough hours in the day to do both. And so customer service really does matter. Now, I will say this to you. Most of the insurance companies today send their customer service overseas. They're going to international call centers. And that's sad. And sometimes you can understand those people, but many times you cannot. And so that's very frustrating. They're going to China, they're going to the Philippines, going to India. And I don't fault any of those people who work in those call centers. They're doing nothing more than making a living for their family. Don't fault them at all. Who I fault are these insurance companies that have billions and billions of dollars who send you overseas to get help from those people. And they understand Medicare. They don't have that in those countries. And anyway, so I'm just, as you can tell, passionate about that. You want to deal with somebody here. And that's why we have our own customer service team. Call in anytime, Monday to Friday, 7 to 7, Thursday, 7 to 6. Friday, 7 to 6, and we help our clients. All right, then lastly, I'll stop with this. Whoever you use, folks, once you've decided you have someone you're going to trust, just know that you don't have to pay the agent any money. People don't pay us a penny. The agent that writes the policy is paid by the insurance company. And the rate's all the same. You could go directly to one insurance company and you'll pay the same rate as you would if you used us. There's no difference whatsoever. The difference is, are they going to give you all your options as well as service you if you ever have any problems? So again, there's no extra money. Can't save any money by doing it yourself. Some people like to do it themselves. So you're going to save money. No, you're not. Price is all the same. You're not going to save any money whatsoever. In fact, you could cost yourself greatly if you do not get help from a real professional. Okay, and we'd be delighted to help you. Lastly, I'll say this. If you have a comment, love to hear from you. You have a question, again, we'd love to hear from you about your issue. We have people monitoring this right now. If they can't get back to you immediately, they certainly will follow up with you. But I do want to mention Terry Yancik. Terry Yancik is the one who really oversees our Facebook group. And number one, Tara is a sweetie. She's a real wonderful, wonderful woman. She's very, very knowledgeable, and she can answer your questions. She can direct you to one of our Medicare guides. And by the way, if you call in, I will tell you, number one, you'll get no pressure. okay? We make our living by writing insurance plans, but we'll never put pressure on you. Some of you don't want to go on Medicare yet, and we'll tell you that. And I tell my agents all the time, if you wouldn't tell your mom or your dad to do something, don't you dare tell one of our clients that. We're going to be honest with you about that. I promise you we will. No pressure. Number two, we'll do our very, very best to be professional with you. We're not perfect. There's no perfect human. We make mistakes, but we really strive to serve people and serve them very, very well, okay? And so Tara will help you in any way to get those kind of things set up. You can also go to MedicareSchool.com if you've not been there yet, and that's our website. And I've got lots and lots of videos, probably more you could ever stand to watch, about Medicare and about Social Security. So again, get a resource, something like our site, MedicareSchool.com, and you can watch those videos and also through that site, set up an appointment with one of our Medicare guides. And when you call in, again, no pressure, we're brokers, so we write for the majority of all the companies that are in your area. I can't say we write for all of them because no one does, but we write for the majority of them. We'll look at all the options, Advantage, subs, drug plans, all those things to make sure that when you go on Medicare, you're choosing the plan that is the very best for you, okay? And you have confidence in those choices. Please tell your friends about us. Medicare Monday every Monday at 5 o'clock Central, 6 o'clock Eastern. I'd love to have you join our group. Again, any comments that you have, we'd be thrilled to assist you. Thanks so much for watching tonight. Have a great evening.